I want to start by saying hello and welcome. And I am so pleased that so many of you have been able to join us this afternoon. For those of you that were at the Adults and Health all-staff events in Crewe, Macclesfield and Sandbach, you will know that we committed to run regular sessions, listen and learn sessions, to discuss the transformation plan, how we were progressing, what we thought we'd achieved, what wasn't working so well, and what you're getting feedback from people who were involved in the process to try and make things better. This is the first of those sessions, and I'm really pleased that there are so many of you here, and I'm really pleased I'm able to join you. I may have to drop out for half an hour at about 3 o'clock because Councillor Rhodes may be ringing me. So welcome, everybody. Daniel, could we move on to the first slide? Because whilst it is really lovely to see all of you here, so just so that you know, we're going to be recording so that we can share the conversation. Could you go on to the next one, Daniel? What I really want to say to you all is I want us to congratulate our OT team, who earlier this week were voted Social Care Team of the Year at the National Back Exchange Awards. And if you turn your mics on, we're going to do a big proper round of applause as well as everything else. So hopefully you can all hear me. It's absolutely fabulous, and it comes hot on the heels of our CQC rating. I am just so pleased, and hopefully you'll get something through in team voice. And I did say, we all knew that they were doing some fabulous work. Now everybody else knows they're doing some fabulous work too. So congratulations to the team, and thank you for making us all look so good. That is really all I want to say to you. I'm going to be handing over to Jill, who's going to start to take us through this afternoon, and hopefully you've all seen the agenda. We'll have a quick wrap up at the end of the session. I want you to think about how this is working for you, because if this isn't working, we'll need to think about how do we do this differently. But we're going to give this a try today, and we'll take it from here. So, Jill, over to you.
Thanks, Helen. Next slide, please, Dan. So, as Helen's just said, for those of you who were involved with our face-to-face sessions, we committed to undertaking further sessions based on your feedback, what you felt an ordinary life should look like and could look like, and how we can shape our services to support that ambition. This meeting is the first one in a series to continue that conversation and to involve all of our staff with future developments, to discuss your ideas and explore them with you and with us. So thank you for all taking part this afternoon. Next slide, Dan, please. So that said, I'm going to hand to Guy Kilminster, who's going to take us through the Blueprint 2030. Guy, are you with us?
I am with you, Jill. Yes. Can you hear me?
Yeah.
And it's only one slide, people will be pleased to know, and it'll be very brief, but I just wanted to emphasise that everything that we're doing within the Directorate and as part of our transformation programme is being done as part of a wider Cheshire East Health and Care System transformation programme. And the basis of that is the Blueprint 2030, which some of you may have come across because it was approved by the Council back in October last year. And I just wanted to give you a very quickly a little bit of background to this and how it's being used more widely across the system with our health and care and voluntary sector partners. So the Blueprint 2030 architecture was created as a result of a number of workshops involving all partners from across the system. It was adopted by the partnership in January 2024. There are 3 pillars to it, which are illustrated in this one slide: healthy households, healthy neighbourhoods, and local health and care services. And the good news is we did this 18 months ago. It preempted the NHS 10-year plan, but it absolutely mirrors the priorities and the aspirations set out within the NHS 10-year plan. So that is good news. And some of you may, for example, have heard about integrated healthy neighbourhoods, which is really a combination of our healthy neighbourhoods aspiration and local health and care services being delivered closer to where people live, so that it avoids hospitals wherever possible. Just very briefly, the healthy households, that's all about trying to ensure that we keep people healthy and well and empower them to look after themselves, their families, and their households for as long as possible. So that needs them to be well informed, to have the information at their fingertips, to be aware of what the better things to do in terms of their lifestyles, and how to get early help if it's required to keep them healthy and independent and well. Healthy neighbourhoods is about having supportive communities. It's very much focused on the community and voluntary sector being an integral part of our system, but also ensuring that we work with colleagues in our other council departments, for example, to try and ensure that our neighbourhoods where people live are well suited from a health and wellbeing perspective, that they're safe, that they have access to the services that they need, and so on. And then finally, we have health and care services being delivered locally, and that's across the health and care system. And it is very much linked to the government's and the Department of Health and Social Care's Integrated Neighbourhood Health Services programme, which is now being piloted in a number of areas and will become the default mechanism by which local health and care services are provided over the next 10 years. So just a brief overview. I'm more than happy to come to team meetings to talk about this in more detail. The full slide deck is very long, but I try and make it as interesting as possible. Thank you, Jill.
Thank you, Guy. If we can move on, Daniel, please. So, this is all about shaping the future of adult social care. I have to say, and echo Helen, congratulations to our OT team for their fantastic win. It was all about the proportionate care project, which has saved a lot of money over its duration. So well done to that team, and thank you to Laura Emmett for pushing for the team to be able to attend. Well done, Laura. So we're back again, transformation. Why do we need it? Well, we need it because as a council, we have to plug a gap of £100 million. And to plug that gap, we can only do that if we transform our services. And we're in the fortunate position that we are allowed to transform our services without someone else coming and making us do it. So it's in our gift to shape services, but it's only in our gift if we all take part. So that includes you. We want to hear what you have to say. We want you to be involved. We want you to be a part of it, because it's only if we're all together we can make it successful. So please attend sessions when you can. And we know there are some colleagues who are quite reluctant to attend any sessions. Can we encourage them? We don't bite, not on a Thursday anyway, but it would be really, really good if we could get those colleagues who are very shy and don't normally attend sessions, if they could attend. So thank you. Come and have your say. We want you to have your say. But throughout all of that, we want to get the basics right. What is it that adult social care does. What is it we do? What should be there at the basis of everything we do? And they're there. We assess people. Everyone is entitled to an assessment. We support people. We empower people to have a voice. Those people who don't normally have a voice or whose voice is never heard. We protect people. And we advocate on their behalf. Those people who are not strong enough to advocate on their own behalf, that's what we're here to do. We collaborate. And guys, you've seen Guy just talk about the blueprints. Well, we're collaborating with public health, and you will see echoes of what Guy's spoken about in our presentation going forward this afternoon. Collaborating with public health, working with our community colleagues, working with finance, HR, legal, in order to bring about a transformation and to give people the service they deserve. And we manage. And sometimes when we manage, that can be really, really difficult. We are managing tricky situations at the moment. I'm sure you are all exercised around staffing and just trying to get our recruitment requests sorted properly. So I am asking for a little bit of patience. We are working with that, but I have a huge spreadsheet to go through now to try and match every recruitment watch. Go back again, Daniel. Thank you. Every recruitment watch with the vacancies on those spreadsheets. But we'll get there. We always do. And with your help, it will be fine. And the end result is we want people to have that ordinary life. We want people to have the life that we take for granted, to live where we want, in the home that we want, with the people that we want, with the services that we require wrapped around us. That's all that people are asking for. They want to be happy, they want to be healthy, and they want to feel safe. And I don't think that's too much for anyone to ask. But we have to put our emphasis where it will give us the best results. And for us in adult social care, based on the work that we've done, the information you've passed to us, we feel that the best results would come from prevent, reduce, enable, modernising of care force, working within shared lives, an LD project. We've already completed the work around partnership reviews, which for most of you means continuing healthcare. And just to say that the inner circle people and consultants who came in felt that our continuing healthcare team and their knowledge around CHC was absolutely second to none. They are and have been hailed as possibly the best continuing healthcare team that Inner Circle have ever come across within the work that they've done. So well done to Micah, to Lou and to Keith for all your work. I think you taught Inner Circle stuff that they probably didn't know. So that's by way of a very, very brief introduction to the afternoon.